Hey everyone, this is Jonathan Marx from GoToHealth. I hope you're having a great day. If you're a teen or the parent of a teen, listen up because I've got some great information. This is all about transferring the teen from a pediatric practice to an adult practice. And there can be lots of confusion and uncertainties, and this show is here to help you with that. Graduation marks a major life milestone, but for many teens, it also means taking on a new responsibility they may not feel ready for, managing their own health care. As they begin to shift out of pediatric care around the age of 18, young adults are suddenly expected to schedule appointments, understand insurance, and make medical decisions on their own, often for the first time. With us to talk about this today is Susan Shansky, MSW. She's the director of the Transitional Care Support Bridges Adult Transition Program, where her full-time job is improving the transition from pediatric to adult care. And if you want to learn more, you can go to healthcare-shift.com.
I think it's a really great resource if you want to think about how do I as a teenager take ownership of my care? Like what are some concrete things that I can do and practice? So it's got some guidance there. And as you said, also for parents, right? The best way for teens to do this is perhaps for their parents to do less of it. So everybody really, it's helpful when everybody has a sense of, both teens and parents have a sense of what everyone else is looking at. Sort of what are the levels we're thinking that you're going to get to? And let's work on those together. Let's set goals together.
So welcome to the show, Susan Shansky. How are you today?
I'm well. Thanks for having me.
Good. So teens can drive, but so many of them find managing their own healthcare confusing. What's so confusing for teens?
Honestly, I think healthcare management is confusing for all of us, not just teens. And so the difference being in this space is that they're sort of new to an adult system where they might be used to a pediatric setup.
Yes, got it. And what are the most common things teens struggle with when they begin handling their own care?
Teens are going to struggle with things that they've not yet had to do, right? Anything new might be hard the first time. Hopefully you'll breeze right through it. But if you haven't had practice doing things from making an appointment to handing in your insurance card to getting your prescriptions, if you've never done any of those things, it's going to be really hard the day you first start out at your adult provider. Right? These are things that have been happening around you, hopefully with you, when you were a child. And so providing some of that anticipatory guidance that pediatricians love to do should definitely include your eventual transfer to adult healthcare and some of these self-management skills you'll need to do.
What's the typical age, if there is one, for a transfer from pediatrics to adult care?
That's a great question. And it's hard to answer. The American Academy of Pediatrics has let's say a rough guideline around 22 in terms of pediatric care. There are questions about pediatricians who are only licensed to take care of children. So even though you may say, well, but my pediatrician is super happy to take care of my 35-year-old son with special needs, it's fine. There are issues with people being trained in pediatrics and licensed in those things, and then not necessarily having the knowledge when it comes to adult health issues that you might want them to screen for. So it might feel like it's a good idea to stay with this pediatrician, but in fact, stuff might get missed. On the whole, I would say that in the early 20s, whether it's primary care or specialty care, around the time people leave school, whether it's their special education program or they're finishing college, roughly around then, people generally do it. There may be places they're like, nope, we have guidelines in this hospital and you are done when you are 18. Yeah. That certainly happens. In places where the healthcare insurance works differently, that might happen as well. But so I'm not going to pin it to an age right there.
No, but I think you're saying an important point, which is let's assume it's either the very late teens or the early 20s. And a lot of time, that's when the kid is out of the house. They're not living there anymore for much of it. So they're really managing a lot of things on their own. So how can families help young people build the life skills they need to navigate adult healthcare?
I think families do a lot to build skills with children and teens, and that might be doing the laundry, and it might be getting your license, and it might be doing your banking. Yeah. This one might be more difficult or less. I don't know. We talk about it less often, but certainly everyone's going to need to manage their health care, right? Whether they have chronic health conditions or they don't. They're going to need something in place so that they can stay healthy, and at some point in time they might have an emergency. Of course, for the third of children who have some sort of special health care need, whether it's mild asthma or autism or a rare metabolic disorder, those families are going to be navigating something slightly different. And they're going to not want to have any gaps in care, and they're going to want to make sure that they're well established seamlessly from pediatric to adult care. And it is a bit of a jump. So for some patients, there's more vulnerability than others.
Yeah. So people can go to this great website. I've been there. It's very friendly, I think, for both adults and teens. It's called healthcare-shift.com. Healthcare-shift.com. Tell us what's there.
I think it's a really great resource if you want to think about, how do I as a teenager take ownership of my care? Like, what are some concrete things that I can do and practice? So it's got some guidance there. And as you said, also for parents, right? The best way for teens to do this is perhaps for their parents to do less of it. So everybody really, it's helpful when everybody has a sense of, both teens and parents have a sense of what everyone else is looking at. Sort of, what are the levels we're thinking that you're going to get to? And let's work on those together. Let's set goals together.
Yeah, so you're the director of the Transitional Care Support at Bridges Adult Transition Program. Tell us about the work you're doing there.
So what's great about the work that I'm doing, and this is true across the country in terms of in pediatric spaces and in adult spaces, clinicians are able to really think about what are the pain points for this transition period, whether they're education, so we might run trainings for providers, be it pediatric or adult, on particular conditions, or there's a lot of quality improvement efforts around putting structures into place. So maybe a pediatric practice has just not heard of this. They just assume that they tell the patients it's time to go, they leave, and it's all set. But there could be more done, right? They could have a very standardized practice around, here's your medical summary, here's the list of providers in the area. Like, really putting standardized processes and workflows into place is something that our team, along with others, really this is something nationally that folks are trying to work on in terms of getting standardized transition programs into place so that teens feel more prepared and less overwhelmed and confused. Also, so that it's easier for providers, so it's not a one-off each time, because your young adult patients are going to adult care. This is great news, right? Patients are living longer with formerly life-limiting conditions. So if 20 years ago, there might not have been any adults with this rare disease in adult care, the great news is there are many of them coming now. And so we have to really prepare all the systems and all the patients and families to get ready for that.
I mentioned before this website, healthcare-shift.com, but what's your website, Susan?
So I would actually point people to national websites about this. It's not mine by any means, but GotTransition.org is sort of the national clearinghouse around transition-related information. If you're looking to put in place a standardized process or think about readiness assessments to use with families, they really kind of step-by-step implementation of how one puts something like that in place. So that is a great resource. I also would say that lots of different conditions have very specific transition resources, robust, in addition to the ones we've mentioned, right? So the Crohn's and Colitis Foundation will have, or so depending on what the condition is that you have, those are good opportunities to see what's available from those sorts of organizations and websites. Plus, your own hospital likely has something. If you're a pediatric patient somewhere, then hopefully your provider has some tools that they like to use.
Good. So, Susan, is there any question I didn't ask that I should have, or what kind of big message would you like to leave with people today?
I think transition to adult care within healthcare, it's this sort of newish, only the past 2 decades have we been talking about it at all, sort of growth area. And it's hopeful, right? When we have diseases where they're used to, that were formerly, I guess, life-limiting, and 40 years ago we wouldn't have expected this child to live outside of pediatrics. Now we've got more adults than children with a lot of these diseases, and we've got to really prepare. We've got to prepare individual patients and families, and we all are going to, as a group, we're going to have to also look at some of the systems that we have and try to ease the way and make sure that they're well connected and as seamless as possible.
Good. Thanks so much for being with us today, Susan. It's been great having you.
Thank you.
We've been talking with Susan Shansky, MSW, She's director of the Transitional Care Support at the Bridges Adult Transition Program, where her full-time job is improving the transition from pediatric to adult healthcare. And again, if you want to learn more about this, there's a really friendly, great website called healthcare-shift.com. This has been Jonathan Marks with GoToHealth. Remember, you can subscribe to us at GoToHealthMedia.com. You can also see us on YouTube, 8 podcast networks. And if you like what we're doing, please give us a thumbs up or a 5-star review or a like. That helps us get evidence-based information out to more people. Thanks for being with us. We'll see you again next time. And as we say at the end of every show, go to health. God bless. Take care. Thank you for tuning in today to Go to Health. You are one of almost 10,000 people per day who enjoy the evidence-based health information offered by our guest health experts. You can watch us on our website and YouTube and listen to us on 8 podcast networks. Be sure to join Jonathan Marks in our upcoming shows each week. If you like our show, please share this episode with your friends and colleagues. You can subscribe to the show, join our email list, send us feedback, browse through the online store, and view our library of over 150 shows at GoToHealthMedia.com. See you next time, and remember to elevate your life with Go to Health.